Now recognize Ms. Purswell for 5 minutes.
On January 1st, 2019, a newly medically retired soldier with her 2 young children moved across the country, leaving her husband behind to complete his own medical retirement process. She began setting up a home for her family. She bought a house, started a master's degree program, and enrolled her kids in school. To everyone around her, she seemed like she was thriving, but in reality, she was drowning. 8 months later, and in desperate need of medical health care appointment, she called her primary care physician to get her mental health intake appointment moved up. She was told again, for what may have been the 6th time, there were no doctors available. She was told again, everyone waits, call the crisis line if you need. No one should have to hear those words. No one should have to wait that long for care. This is my story. Chairman Takano, Ranking Member Rowe, and distinguished members of the committee, on behalf of our National Commander, Bill Oxford, and our nearly 2 million members, we thank you for inviting the American Legion to testify today. As you know, the American Legion dedicates its time and resources to serve America's veterans and their families. Our mission has never been more clear than during this time of pandemic and uncertainty over how our country will recover. As such, local American Legion posts are working overtime to help our veteran families. Legionnaires have collected food, hygiene, and cleaning supplies. They've prepared and delivered food, held blood drives, and made face masks. Our national commander's call for buddy checks have increased to our members to ensure we are meeting the needs of our veterans. We have held financial workshops, resume writing seminars, virtual career fairs, town halls, and networking meetups. Ladies and gentlemen, the American Legion will continue to serve our veteran population and others because that is who we are and that is what we do. But we need Congress to meet us halfway by providing sound legislation that supports our veterans. Legislation like H.R. 3228, which affords veterans, like me, the ability to see a healthcare provider more quickly through telehealth by allowing veterans to be seen by a larger portion of VA. This bill also offers those still in training the ability to become proficient in a new type of medicine, a skill they will no doubt need in order to continue to serve our veterans. Not only has the age of COVID-19 created a health crisis, it has also forced unemployment and reduced income upon many of our veterans. We feel that H.R. 7111 will help bring down the unemployment rate of veterans who have lost their jobs and critical income due to COVID-19. The current unemployment rate for veterans has more than doubled in the last year. With nearly 17,000 service members leaving active duty service every month, these numbers will not fall anytime soon. If done correctly, the Economic Recovery Act will help veterans, young and old, transition into new jobs. As we consider employment issues that affect our veterans community, we also need to recognize that members of our National Guard are affected by those same issues. National Guard soldiers are helping first responders battle the pandemic through security operations, testing veterans for COVID-19, and helping deal with the threat. They are constantly being mobilized and demobilized, which takes them away from their steady occupations. At one point in June, nearly 1/4 of our entire National Guard, 120,000 soldiers, were mobilized in our communities. These service members deserve to return to the lives they were living without fear of being jobless. The USERRA Protections for state active duty will allow these service members to fall under the current USERRA guidelines. The pandemic has brought havoc to veteran employment just as it has disrupted veterans' health care. Because of COVID-19, VA medical facilities had to stop providing veterans with compensation and benefit examinations, a critical component in the granting of VA disabilities benefits. H.R. 7287 will allow the backlog of veterans who need C&P examinations to get appointments more quickly with providers. This will be accomplished by allowing physician assistants, nurse practitioners, audiologists, and psychologists to perform exams across state lines. In mid-June, the backlog for C&P exams was more than 125,000 cases. Our veterans need these exams as medical evidence that can be reviewed when their disability claims are adjudicated. They have earned VA disability benefits through the sacrifices they have made for this country. We must rectify the delay of VA medical exams caused by the pandemic. I conclude by thanking Chairman Takano, Ranking Member Rowe, and this committee for your incredible leadership and for always keeping veterans at the core of your mission. It is my privilege to represent the American Legion before this committee. I look forward to answering any questions you have.